A lifetime of hard work, children laughing in the kitchen, family photos on a restaurant wall, a legacy that lives on. It all comes from the power of a conversation, like the one Tommy Hall had with First Horizon Bank about taking over his father's Charleston-based restaurant business. Now the table is set for a whole new generation. First Horizon Bank. Let's find a way. Go to firsthorizon.com/Tommy. First Horizon Bank, member FDIC.
There's a fine line between genius and insanity, and we're walking it. It's the Marketing Madhouse.
I'm Moira Vetter, your host for Marketing Madhouse. Today, we're diving into the crazy world of healthcare marketing and exploring the importance of diversity in leadership and in business. And my guest today is longtime friend Kacee Huguely, Vice President of Marketing at Mölnlycke US, a medical solutions company. And she has worked at the best of the best. I know when people think about brands, they think about companies like Coca-Cola. But she's also worked at GlaxoSmithKline and Eli Lilly. And as a kid raised by a pharmacist, I am all about those brands. But I'm so glad to have you here. Why don't you tell us a little bit about yourself and how you got your start in marketing?
Absolutely. So thanks for having me, first of all, Moira. And I have to say, as another kid raised by a pharmacist, my dad has been for, I don't even know, forever. It's kind of cool to touch those same brands, too. Mm-hmm. Didn't even realize I was going to do it. But let's see, a little bit about me. So I went to high school in Atlanta, went to one of the best colleges in the world, Howard University, in D.C., and then quickly moved into pharmaceutical sales. Thought I was going to be a journalist. Really thought that was going to be my life. So being on the microphone all the time.
On campus?
I did get recruited on campus, and thought I was just going to do it for about a year, and never looked back. So there is that. But moved all over, did a lot in sales, thought sales was going to be my path, and then got sucked into marketing. So we'll talk about that, but it's kind of crazy how paths change and you end up doing what you're supposed to. I'm married, have 3 kids. My oldest is in college, and it's a crazy time.
Yes, quite a shift that is. Yeah.
I can't believe I'm old enough to have a child in college, but we'll talk about that later. Thank you. I'm just a baby. And it's kind of crazy. Marketing is, and I firmly believe this, marketing is very much an extension of sales, but it's figuring out how to sell differently. Yep. And I think sometimes it seems very intimidating to people, but we have to figure out how are people going to know about brands. How
it's handling all those other objections that the salesperson doesn't have time
know.
To field.
They're not going to think about it, and it's also creating the demand for the salespeople so that it makes it that much easier for them. But people just they don't get it, and I didn't get it until I jumped into this crazy world, for sure.
Well, it's funny you said, well, you thought you'd be a journalist. I was going to go to film school, and then I was a salesperson first, and then I was a marketing person. And having been a salesperson, I talked to a lot of collegiate marketers, and at KSU, I'm on the board at KSU, and they have the School of Professional Sales and Marketing. And they have a sales school there, and there are some courses that people that come through that marketing program do. And I always say to the marketing people, there is no better grounding in how to be a marketer than to, wear the hat of a salesperson.
Absolutely, and carry the bag.
Yep.
Yeah.
Yep.
It really does. You don't understand, and I think we used to call it at Coca-Cola operational marketing, and I now say that some of the best people on my team are smarketers. That's what we, it's because you started in sales and you understand the realism that comes with marketing. You don't just live pie in the sky. You need to be strategic.
Just named the episode with smarketers. That's
Smarketers.
That's
yes.
Yeah. No, it really it's amazing. So you've dropped the Coca-Cola word a couple of times, and I think it's interesting. You grew up here in Atlanta, and when I came to Atlanta, everybody associates Atlanta with Coca-Cola, and obviously one of the most major brands in the whole world. Probably in every case study for
everything
for
business
everything.
school.
Yes, for business school and marketing and all of that. And so that was when you and I first worked together, was at marketing. And, one of the things that I always enjoyed about that, from a pharmacy standpoint, we always pointed out that Coke was a healthcare company, a pharmaceutical company, before it was anything else. But can you just talk a little bit about Coke? I mean, it's such a, it's a legendary company.
Monster brand.
And you are now at Mölnlycke, which is a Swedish healthcare company. So probably there are a lot of people that say, how do you go
How do you do that?
from Coke to that? So talk a little bit about Coke and then talk about your path.
Absolutely. So it's a very interesting journey actually to get to Coke. So like we said, I was in pharmaceuticals, I was in sales, and I was in the Northeast. And I met my soon-to-be husband at the time. And we got married and I got pregnant and freaked out because I had never planned to be a mom, just didn't think that was my path. And we moved to Atlanta. And so I took a step back from sales and said, okay, I'm going to be a stay-at-home. And after about a year, I was like, no, I don't think I'm going to be a stay-at-home mom. I think that's not my path. And so I met a woman who was head of sales at like a play date. And we started talking about different things. And she said, do you want to keep watching kids? And I was like, no, I don't. And
for all those people that don't think business happens when you are a stay-at-home mom,
my
right?
goodness.
The play date is the best
play date.
networking environment.
I mean, who knew to go from a play date to getting a job? And she, we talked about sales, and she said, gosh, it's really, this could be one of the most challenging things for you. And I was like, come on, I used to sell heart failure drugs and I used to be in the OR. And she's like, I promise you, you will see. And so long story short, ended up in sales at Coke and started in a variety of different places, but I landed in what Coca-Cola calls on-premise, which basically means you are not there to drink beverages, but you consume on-site. So like college campuses and hospitals and workplaces. And after a couple of years, I was doing really well, and then Coke started to get attacked in the healthcare space. A lot of hospitals decided to put up the stoplight system. If any of you have ever been in a hospital, you might see like red means don't touch it. They would put like bags of sugar next to things, and of course it was always the soda. I'm like, no, not the ice cream, not the the French fries, but it's the soda. Yellow was with caution, and green was go for it. So that was basically just water. And healthcare was not a space that Coke was comfortable with. Most people don't read the labels. Most people don't understand sweeteners. And so I got asked, because I was so comfortable in hospitals with my background, hey, can you help us come up with a strategy
what are
for
the
how
healthy angles
to approach this world? And I hadn't thought about that because I'm like, I've always been a salesperson, but the ideas just started flowing. We came up with a whole team just to work on, we called it Live Positively. And it was just sort of trial by fire for marketing, but that's what started my path.
Well, and I remember the Diet Coke and the nursing, right? I mean, you're talking about being on premise. It's not just the patients.
No, it's the employees.
Everybody there.
It's everybody. And it that was one of the big things was nurses gravitated towards Diet Coke. They would consume 6 to 12 a day, depending on the nurse. But everybody kept thinking Coca-Cola. And so we had to think about how do we brand differently. And so, I was thinking about as I was getting ready for this, one of the biggest things, and I think one of the riskiest things I ever did was to go to the head of North America sales and say, I don't want to put a Coca-Cola sign on anything in a hospital. And for it to be the flagship brand, but we wanted to put the Diet Coke sign and the Coca-Cola Zero sign because that just mentally, it's amazing how a color can shift and not having the red.
But it's so
it
smart.
Was a game changer.
It was the thing to do.
Yeah.
Well, and I remember too at the time, and you think about this with global brands that have portfolio. You have a portfolio now, but just different portfolios.
Sure.
I remember looking at Total Beverage Solution, and it was when all these acquisitions are going on with water brands and tea. Yeah. And it's like, this is the time to push
leverage all
those other brands.
Absolutely. And that was a big deal for Coke because for so long it was all about the sodas, but they realized they had to diversify. There were so many other brands. They called them the still brands versus sparkling.
Yep.
But you're right. We had to do it. And to put them front and center was a pretty big pivot. But, you know, I think that's the beauty of marketing. You have to take risks. And when you do, you know, hopefully they pay off.
Yep. So you just said diversify, and so I'm going to touch on this for a minute. So we are powerful women in the world, and you know, in healthcare, there are different pockets, and I've worked in technology. You've worked in a lot of healthcare. There are places that you see women very heavily, such as the nursing area, and I want to sort of break this apart and do a little bit, and then we'll go to a break, but. Can you just, from your standpoint, how have things changed from 20 years ago to 10 years ago to now?
Gosh, it's such a good question. You know, I think 20 years ago, most of the women were in support roles, like nursing, like technicians, like the administrative, kind of more junior staff. Even from an industry perspective and those calling on healthcare, it was still very much kind of the more junior salespeople, maybe a sales manager, the occasional head of sales, but pretty infrequent. And then 10 years ago, I think we started to see more of an explosion. There were more women. Just more women going to college.
Yep.
So then more women who were in, you know, physicians. Then more women who were having more seats at the table, at least from a D level perspective.
Okay, this is a strange sideways question, and then we'll probably go to the break. But I made the assumption immediately when you said I was at Howard, and then I was like, oh, they recruited you on campus, right? Because you can really present well, and and you're tall,
and I'm tall,
and you're tall. So I can imagine you going in there. But do they recruit men on campuses I always had that assumption. Again, going back 20 years ago,
Sure.
It's like we're going to find all the attractive women, and we're going to make them pharmaceutical salespeople.
That is so funny that you say that, because let's see, for my new hire class, probably 75% of us were women. So yeah,
I
mean,
just
because
wonder if that has switched,
a lot
right?
of the absolutely, it's definitely pivoted. But think about it. I mean, I hate to say it, but most of the physicians were male,
right?
So who to look at? But young women,
right? We're going to get this medication in here one way or the other.
But what made it hard was usually the we call them the gatekeeper, that receptionist or whoever else at the front door. They were female, and they didn't care about us at all. So
turn that bag around and wheel it right back out.
Get on out of here, because he doesn't want to see you. But it's crazy that you say that, because now it has pivoted. I mean, I actually was just at a National Psoriasis Foundation event this weekend, and most of the people who were recognized were female dermatologists. So it is kind of interesting how, I mean, I'm dating myself, but 20 years, what a difference.
It's exciting to see things come full circle.
It definitely is.
All right, well, we're going to go to a break, and we will dig in a little deeper into some of the challenges of healthcare marketing.
Tonight in Arkansas, there's a mother tucking in her daughter and turning off the light. A business owner is burning the midnight oil. An at-home dinner date is plating up possibility. And it's all happening under one roof. How? The power of a conversation, like the one John from Integrity Solutions had with First Horizon Bank about his vision for a sustainable mixed-use building. Now it's not just words, it's life. First Horizon Bank. Let's find a way. Go to firsthorizon.com/John. First Horizon Bank, member FDIC.
We're back with our guest, Kacee Huguely, VP of Marketing at Mölnlycke. And so we worked together years ago, but we had a little pause in there, and we didn't start working together again until just before the pandemic in 2020. And I mean the week that it happened.
Yes.
And so obviously when you think about marketing, it's always been interesting, but particularly in the healthcare space. What drove your business and your marketing decisions then, in 3 years ago versus now?
Oh, gosh. I mean, dramatic difference. So I think one of the things that shocked me leaving consumer was that healthcare is probably 10 to 20 years behind when it comes to advances in marketing, like digital marketing.
Yeah.
When I walked into Mölnlycke, so I started November of 19. The week I got there was a room that was just held for like sales collateral, like paper
a whole
materials,
room, like a
whole
library
room.
for the paper.
Like a just of paper, just
Yeah.
of stuff. And I was like, what's here? What? And of course, the day you print it is the day it's old.
Yeah.
So I couldn't believe that. And they said, oh, well, we can turn it into a PDF. And I was like, okay.
No, but
So you talk about a driver. So 5 months later, we're in a pandemic. I don't have salespeople being able to go into facilities to hand out paper.
right.
So how do you move and create a digital world
Activate
for people
ideas.
who don't understand digital? So that was a big driver for us because we needed to get information to caregivers and to clinicians in a way that they could access easily. But I think the second driver that was really important for us is that these were people who were on the front lines every day. We were all locked behind at home in the comfort of our homes. They were not, didn't have that luxury. So how do you get to their mind share?
Right.
And be sympathetic to what they're dealing with, but also make sure that they are able to meet the needs of patients.
Yeah.
And so I think that was huge. The difference now is we're still struggling with mind share. We're still trying to market to them, but now it's because so many left the industry. In the last 3 years, we've seen a mass exodus for nurses, for physicians, for techs. I mean, it's across the board, but in healthcare in general, we're at a nursing shortage. We're at a physician shortage. So there are a lot less people doing a whole lot more. And so how do we get to them and help them understand?
We helped you with one of those because
You
during
did.
the first couple of weeks of
Yep.
the pandemic, we had one person leave to go become a nurse. She moved back home. She had just relocated to Atlanta, and she's like, I'm
We
going to go
needed
be
that.
a nurse.
Yes.
Right. Absolutely needed that. Now, I think, you bring up a really, we talk about mind share all the time, but I think there is something about being honest about what mindset people are in and what they are dealing with, and whether it is, healthcare professionals in a pandemic or whether it is financial services people in the midst of a recession and crazy, you're only going to get so much of their mind share. So there's a couple of things which are knowing where you fit and being realistic about that. But then the other thing is how do you get better impact from the things and be realistic. All right, so you talked a little about this getting off of paper and sort of moving into the mind share.
Yep.
But so from where you are today, how have those things changed? What are you thinking about now in terms of marketing? As of course I already said there's a recession.
Yeah,
I sort of teed that up a little bit, but. So it's financially interesting in the world. So what are your greatest couple of things that you're looking at now that are impacting?
Yeah, well, I mean, I still have to walk it back to in the pandemic, and you remember the government offered just a lot of dollars to healthcare facilities, so they were more focused on what's the best thing, irrespective of price, for patients, for our team. Now, so many hospitals are operating in the red, and just a little bit of growth is great. None of them really operate in the black. So what we're trying to do is go back to the message that we had 3 years ago of value, because something cheap today is going to send a patient back to them sometime. So what might feel great sticker price is not going to be good long term. And so really trying to bundle a solution that says, I get it, it might be a little bit more expensive on the front end. And we all live in how much does it cost today, but being able to offset that with, wouldn't it be better if you do the right things now that those patients don't come back? Because that's really where they get penalized the most.
Well, I think I just made a note about, remember why you spend the money that you spend. I think that is a harder case to make. And I've worked on a lot of premium brands. And I've worked on a lot of companies that have maybe a longer term value proposition than people that are very short term or cost only kind of things. And, it's just, it is, you kind of have to do more math. You have to do more education, right? Everybody's always wondering what's all this content going to be about. The content is going to be about these journeys and what if, right? A lot of what if scenarios.
Well, it's funny you say that, because really when you talk about the math, we're also changing who our customer is too. So our customer used to be the nurse, the physician, because they had all the power. to make those decisions. Now it's procurement, it's the C-suite, it's people who are looking at everything. And so we have to go to the math. We have to talk about short-term impact, long-term impact. And that changes all of the things that we try to message because now it's not just about, patient impact. It has to be about the broader thing, P&L, ultimate budget. So it's an interesting pivot from who our customer was to who our current customer is.
We have another client. It's not healthcare, but a similar thing. We always would think of it as the three-legged stool when we would go to market with a message. So there's a company that is in the wire and cable space. And so you would always have to have the message for the engineer, the message for procurement, and then the message for the person that is the installer or let's call them the end user, but the person that has to install or maintain the thing. And so, those three groups of people have entirely different consideration sets. They come into the opportunity at different places. So let's talk about that a little more. So in terms of healthcare specifically, and we do a lot there, not unlike the example I just gave. There is a lot of complexity. There are all these different decision makers. And, so, I had just made some notes about, there's innovation in offerings. There's all these changes going on in terms of payments and money and how money changes hands in a healthcare environment. And then just from some of my past work with healthcare, constant consolidation. Constantly, right? It's just, but Absolutely. I thought they were the customer. Well, they got acquired by somebody else. And then as soon as you retrench and establish yourself, somebody else. So with all those moving dynamics, can you talk a little bit about how does that create opportunity for you? How does it create challenges? How do you address this?
Yeah, I think the consolidation is probably one of the biggest ones because now the independent community hospitals can't be on their own. So consolidation really is critical for them to be able to stay afloat. And so the environment that used to be a bit fragmented of group purchasing organizations, so basically it's just collective buying power, they have grown to be, there used to be 10, 12 in the industry, now there's 3. And they make a lot of decisions and all of the hospitals want to be a part of one of them because then they can get, the more facilities that are a part of that, then the cheaper prices and the better access to different things. And so we're talking to them. So as you talk about that three-legged stool, those GPOs are really important for us. Now, integrated delivery networks. So basically a hospital used to just be a hospital. Now we have to talk to the head of IDNs. So a hospital could have 5 more hospitals in their space, plus a couple of clinics, some home health agencies. Like there's just a lot more that are part of, like here in Atlanta, Northside has way more than just Northside, main campus, off of Johnson Ferry. Right. There's Northside Forsyth, and there's Northside Gwinnett, and they're just more and more Northsides. It doesn't mean the hospital is brand new, but they got gobbled up by Northside. And so I think that's the interesting dynamic is we know the players, but there's less of them now, and those decision makers have changed. So talking to them. And then I think the third is the patient and therefore their caregivers sometimes are, if they are in a space where they need a caregiver, they're becoming so much smarter, which is great for all of us. We have access to everything. And pharmaceuticals used to be the only ones that really talk to patients. Now all of us need to talk to patients because you can Google anything. You can be somewhere. Our
director of media always talks about Dr. Google.
It's what we all rely on. And so if the information out there is not viable and meaningful and hopefully credible, then people can go down really different paths. So I think we are really thinking about it in a very different way than even a patient of 20 years ago or even 10 years ago. Yes, Dr. Google is super real.
So, this is interesting where you're talking about the consolidation into the GPOs down from 10 or 12 down to 3. Years ago, we had a client that was that was bought out of conservatorship because there were only the government said we got to keep this business going. There are only 3 people that do this, so they can't fail, right? We got to, and so private equity was brought in and said, stand this up and keep this thing viable because we're going to end up in monopoly territory if we can't keep it going. But when you're down to essentially 3 GPOs, how do you give enough voice, I guess, to the clinical decision makers, and how do you manage that when?
Yeah, it's tricky. I think what's helpful is that each of the GPOs still wants to rely on the clinical value at the end of the day that they bring, because what they're doing is now fighting. Northside can say, do I want to be a part of A GPO versus B GPO versus C? So we need them to see why this one would be more viable. So the clinical is still the foundation. It's really just then, obviously, cost is a big driver, as well as also access. So for us, what's really important is being able to talk to them about the categories that we play in and why it makes sense to, sometimes what they'll do is say, we're only going to have one supplier or we're going to have multiple suppliers. And so we try to talk to them about the value of sometimes when it is necessary to have 2, or why it's important for us to just have one.
Well, and that reminds me of, again, you get a special specification, right?
Exactly.
There's only one offering that does this, and therefore we need to get spec'd in.
Right. And then if not, I think sometimes where our credibility increases is when we say, hey, look, we're really good at this part of the category, but we know we don't have the full offering. So we think it would be smart for you to have a couple of suppliers. I think our credibility goes a really long way when we can say that versus, oh, no, we're going to meet all your needs except for this and this and this. Right. And I think that's where our industry is right now, of just trying to say, okay, let's niche it out. So categories are really important, but it is an interesting space. There's a finite number of hospitals, and unfortunately, even that number is shrinking. So, mind share, back to mind share is just so critical, and it can't just be dollars. It also has to be clinical.
Yeah. So some of the listeners that end up listening to this podcast, particularly if they're listening on radio, are small business owners. And, small business owners, you can make whatever decision you want, right? You can take risks with your marketing. You're not regulated. Yeah. But, healthcare is very different. And so we work with clients that are in healthcare and, financial services where there is a tremendous amount of regulation. But how do you be in a space like that and still push the envelope enough or take enough risk to make a difference or to pop through? How do especially having come from Coke?
Oh, sure.
There's all kinds of risk taking that goes on there
every day. Yeah.
So how did you bring that in, or how do you do that? Well,
I think you're always trying to. I feel like I'd rather get it 80 or 90% right than wait for 100%. So I feel like you can always take a little bit of a risk. But one of the things that I'm actually really proud of that we're doing with you guys right now at Moto is we're about to brand bus stops and in a hospital, which a med device company has never done to our knowledge. And so it's not like we're still regulated in the things that we can say, but we can try different places. We can put our message in different areas that we think will intersect with the people who are making those decisions. And that's completely radical.
Like,
what? Did I just see something? And yes, we understand most of procurement is not going to be at a bus stop, but they're going to drive by. They might be standing talking to someone and it catches their eye. I mean, we just have to be in disruptive places. And I think that is something that I'm always willing to push and try and take a risk.
I love that idea of being in disruptive. I think people always think it means you have to be disruptive, say something disruptive, but just being somewhere people don't expect to see you.
Why not?
Yeah, especially from Mindshare.
Yes.
Okay, so since this is the Madhouse, we like to talk about crazy things. And we've had some doozies. And I encourage you to tell me something nuts that has happened to you, and it could be something you were asked to do or a situation. So what's something crazy?
Yeah, I mean, I teased it a bit before with what I did at Coca-Cola, but I will say if most of us, anybody listening, and obviously for you and I who've been around, unfortunately, more than 20 years, a little while.
Yep.
Most of the time when you think about a Coca-Cola machine of any kind, it was always red.
Yep.
Always. Like people go and hunt out at like yard sales, like those red vending machines.
Yeah,
right.
Yep.
And we knew that red was offensive in a healthcare space. And so to invest in changing the outside of any machine, whether it was a cooler, vending machine, whatever, to be silver or black, to reflect Diet Coke or Coke Zero was huge, because we're talking millions of dollars in investment. Now, sure, for Coke, that was a bit of a drop in the pan, but regardless, it was walking away from Coca-Cola Red.
The hard shift was not the money spent on the machines.
No,
it was
the shift.
Decision. Yeah.
And the decision that as a director, and I'm going to the president of North America and saying, you need to do this and do it like tomorrow, was a pretty, I mean, I honestly do feel like it was probably one of the craziest things that I'd ever asked for, because we were going to do that blanket wholesale with, sure, some market data, but it had to be a hope and a trust too. There had to be a really big risk that he was willing to take. And we had enough information, and I stalked, yes, I will say, I stalked 3 different heads of healthcare systems to get their sort of their take on camera. So used my just iPhone and went out and I said, hey, you've been saying this, and, you know, in our conversations, will you say it on record?
Yeah.
And they did, because they said, look, you know, this is, if you don't do this, we're about to kick you out, or you can only have water. And I knew that that wasn't going to work. And so after enough, you know, pleasant stalking, I got all 3 on camera. And so when I went for the pitch, I said, this isn't just from my perspective. Let me tell you what these CEOs are saying. And that was it.
That was it.
We walked out. It wasn't even a 30-minute conversation. And he said, okay, Kacee, go ahead and do it.
Do it.
And that was, I think, probably it made me say, I'm going to take way more risks in the future. I'm going to try more things, because my gut said I need to do it. But then I got the validation with obviously the customers. And then to be able to say I'd presented my facts well enough to shift, I mean, at the time, 100-year-old brand, to say I'm going to walk away from our signature color. I mean, you can't even, it takes an arm and a leg for a vendor or anyone else to even get Coca-Cola Red, let alone say you're not going to use it. So I was pretty, I still feel like to this day it's probably one of the craziest things that I ever did. Probably the stalking as well as.
No, but, you know, so I have a follow-up on that, because I think, you know, I was going to say, how did you present that with confidence? But you had the voice of the customer with you to make that presentation, so I get that part. But how did you have the confidence to know you needed to do this, that you needed to go do this? Because I think a lot of the time people don't have courage, right? Unless they have data, right? They think they have the data, but I talk to so many people and say, well, you don't begin to have the data unless your gut tells you there's something here, and I really think we should look at it. So how did you get there?
Well, I think the confidence comes from starting to talk to people. So I was in and out of hospitals all the time. I had a very small team who was comfortable going in hospitals. Again, most Coke people are just scared of, you know, they're like, oh, it's hospitals and people are sick. And
those were the people that were going into QSR
those
and
were the people,
hospitality, right?
So they knew the fun, you know, fries and a shake. And then you go into a cafeteria where you might be next to someone who, you know, maybe lost a spouse or someone else. And then the person who treated it, just very, very different. Not really always the fun vibes. And so that was intimidating. But then to talk to our actual customers, you know, hey, if I were to just change what's in here or change the color, how would you feel about that? Oh my gosh, like, because you know they immediately started saying, yes, absolutely, I'm getting the head nods, I'm getting the, ooh, what about this? You could tell things go well when people build on your idea, the yes and, or, you know, the but no but like you can tell that there's some buy-in. And the more I started getting that buy-in from, at a ground level, I knew there was more to it. So I felt more confident because it wasn't just, I don't know if I agree with that. It just kept building. It was a snowball. Oh, I love that idea. Oh, that's a great idea. Oh, could we try that here? When could I do that? I kept getting the buying signals, so I knew something was right.
I think that all of that about talking to the customer is so important. I feel like, one, for building confidence and really knowing what you're talking about, but also I think too often, and particularly for us in B2B, too often people are talking to their internal team, their operations people, their engineer, the people that invented things about how they should market it, and not enough time talking to the customer about how they want to, whether they want to experience something or buy something and all that.
Well, I think it goes back to, I know you like my word of smarketing, but from a sales lens, I'm never going to do anything without validation from the customer. It's important to have. And if we do our own internal dialogue all the time, that's why people think sometimes marketers come up with these lofty ideas that are never going to translate in the market. You need the validation.
Because they're too divorced from the organization.
Yep.
So I have a question about, so you work for a company that is a Swedish company founded in 1846, I believe.
Yep, you were right.
And you operate globally. So can you talk a little bit about that in terms of how does that impact how you go to market differently? Obviously, healthcare is very different in different in different countries. How have you sort of approached
navigated
that?
Yeah. Sure. Yeah. I mean, the Swedish/European/Icelandic way is very consensus driven. It's very kind of don't be in disruptive places. So I think the first approach is saying, hey, in the U.S., we have to be. There's more of everything. All of Sweden is 6 million people. I think that could
Atlanta.
be about Atlanta, right?
Yeah.
So it's trying to, I think Atlanta is bigger. So trying to help explain. So I have 30 major metros that are bigger than all of the country that we started, and so we have to do things differently. They are governmentally regulated, so there are a couple of companies that get to do things in Sweden. There's so much, and the government only gives us so many parameters here. We get a lot more discretion. So just trying to level set what our market is, and then saying, okay, but look, we've been successful, so let us try different things. And I think what has been great about the Swedish collaboration is, if it works in the U.S., a lot of times then they want to take it and say, okay, how can we change that a little bit for our market? And so many times we're sort of the global stand-up, if you will, of, okay, well, if it did this for the U.S., there's probably a pocket of the U.S. that's like France.
Right.
That's like Sweden. That's like, Middle East.
Yeah, right. So actually looking at subsegments and markets.
Yeah, absolutely. And so that's been what I think has been really great, is saying, give us the runway, give us some flexibility, push us when we're going a little bit too crazy, and then take our learnings, take our best practices. And so in many ways, I feel like the global headquarters sometimes are also here in the U.S.
Yeah, exactly. Well, I think that's fantastic, and this is a great conversation. We are going to be right back with our guest, Kacee Huguely.
This morning in the Atlanta airport, no one's missing a meal on Mac Wilburn's watch. With 11 restaurants to serve passengers, he's got dining for every destination. And it all started when Mac talked with First Horizon Bank about opening a franchise in the airport. Now it's open for business and cleared for takeoff. First Horizon Bank. Let's find a way. Go to firsthorizon.com/Mac. First Horizon Bank, member FDIC.
And we are back with our guest, Kacee Huguely, VP of Marketing at Mölnlycke. And we're talking about healthcare marketing today. But we've spent some time not only talking about healthcare and women in business and Coca-Cola, which is the great giant. But I want to kind of switch for a minute. We've had the privilege of working on, huge companies And it's sometimes hard, to find companies that check all the boxes, right? That are not only fantastic in terms of their brands with their customers, but also, great employers, have a great employer brand, and then also being out in the community. And I know from past work with Coke, they check, a lot of these boxes. But it's always interesting to see people's take on, a company I think of. And it's actually great education for me to learn about companies that I wouldn't have thought of. But is there a brand or a company that, from your standpoint, checks all the boxes? Who is it and why?
Yeah, this is a tricky question. I really chewed on this one for a while because I think there's a lot of companies who have been, we thought were such great stand-ups, and over the last couple of years have really been beat up and
Slipped.
Yeah, yeah. One of those. We could probably go deep on that, but who I think has been able to manage so many different storms and is, in my opinion, kind of one of the penultimate brands is Nike. And one of the main things is, I knew even at Coke, so everybody holds up Coca-Cola as one of those master brands.
Yep.
If Nike came courting you, it was something to consider. And usually for someone like a Coca-Cola, no. Right. But even bigger than that, when everything started happening with like Black Lives Matter and LGBTQ plus rights and just different different things that most companies said, maybe I'm not going to go down those political pathways. Nike was very clear, stood in it, and said, here's where we are. Different types of diversity was applauded. I even think about, regardless of how you feel, Colin Kaepernick, and when they decided to still pursue this big branding with him, and I think that says something to the athlete and the person.
About not cutting bait.
Right.
Yep.
It's like we care about the people that we've brought on board, and I think that says something to the longevity of the people who work there. I don't hear about a lot of people who leave Nike. Yep. And then the give back. You talk about I think it's Play 365 plus other things about investing in people and children and getting them active. They've become much better with the sizes for their clothing. It's one of those brands that has fully lived into just do it. Like if they say they're going to do it, they're going to do it. And it's who as a person who wears the brand, it's like, okay, now I can do it. I'm going to go run that marathon. And they also live into it. And I think that's pretty impressive. There's so many brands who I think have this wonderful positioning, but maybe don't live it out completely. And the brands who can fully own that, it says a lot.
It's interesting to me because you just said the word positioning, and that's what I was thinking when you said, I can just do it, and they have, lived that slogan. I think people forget how powerful a tagline can be if it is truly aligned with who you are. And there's a lot of kooky things that happen in taglines, and a lot of overly people overthink things or get overly clinical, and nobody can feel it. But when you do have something that is aligned with who you are, it also instructs the organization.
It does.
And I think it is harder in places like healthcare too. Other than whatever, I'm sure there's some healthcare system, that has something about, healthy lives for all time, blah, 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 right? We get that, but then how do you use that as guidance, right? What have I done today that stands up to this measure?
That's how it's really good. Yeah. When everybody can say, it's easy enough for me to say, does this fit with our positioning? Does this fit with our branding? Or does it not? Because then it's super hard work to do it. But once you do it, everybody knows. And ours right now for Mölnlycke is free patients from the burden of wounds. I think it's a really powerful vision, destination. I think we are moving to living up to it for sure.
Explain for people listening why the burden of wounds and what exactly.
So if you think about wounds,
yep.
Yes, because this is a fascinating world that I have moved into. So you could go and have a surgery, and whatever surgery you had to be closed. So that closure, you know, if you had a baby and the C-section, it might have been just great. And they sewed you up and you had a little bandage on top for a couple of weeks and you were good. Sometimes it doesn't work that way. And you could be infected. You could have opened it. Anything could happen. And so that's one type of wound. Then as you get older, you know, we don't move as much. You sit a lot or you lay a lot. And then maybe there's a wound we used to call them bed sores. They're called pressure injuries now. And so that could come from somewhere where you've just not moved or not moved enough. And so the goal is that we create the things in our lives to help remove that. So whether you are laying in the bed for 20 hours, you don't develop a pressure injury, or you have that surgery and you heal completely. And so there are things there to help you heal. And so we really are trying to free patients from the burden of wounds, because wounds, once you get one, especially if it's like that pressure injury, it can always come back.
Well, and that's something
tough.
Isn't there's a lot of obesity, particularly in America, more so than I think some other places. And diabetes is on the right, and there's all kinds of
the
things,
comorbidities that just lean absolutely. And so, and one of the things that as a woman of color, that's a big passion point for me is it's been a visual assessment in the U.S. for a really long time. Yeah. But if you have darker skin tone, how do you visually assess? You can't. And so now we're really trying to move towards looking kind of infrared and different ways to look below the skin, because my eye can't detect on a person that's darker texture. I can't tell if you have a pressure injury versus if you're super fair-skinned.
So, because I'm super pale, so I would show like some pinkness.
You would.
That you might not
that
see.
I might not see. Absolutely. And so how do you? But that's not. So then we misdiagnose.
The soap method, that they're using. What is soap?
Yes. It's the Braden scale. So it's really just trying to look and say, okay, if this looks pink or if this has a little bit of different discoloration, but again, it's all visual. And so that's great for a certain skin tone. But once we get a little bit darker, it just makes it too hard. And so there's a lot of digital technology is so critical for us, plus other factors, so that we don't have to. So if you're diabetic and you're overweight and maybe you hardly ever move, well, those are different factors that should already tell us you're probably at a higher risk. But then we need to start to look, and we
see,
can't
this is where us nerds can go down this rabbit hole, because we were talking about taglines and we get down into this.
I know, right?
No, but it's interesting. I think we just have a couple minutes left, so why don't we speed round it a little bit? Maybe on I'm going to go over here to digital best practices. Okay, because we started in the beginning talking about digital and how hard it's been to get people to digital. So that seems to be something everybody likes to talk about.
Absolutely.
In terms of marketing.
Digital is fun. Yeah, I mean, I'm a little bit sad about cookies, but I feel like the way to get to people now, and the one I really want to get to if I can't do cookies, is social media. And TikTok. Having teenagers, I'm learning that TikTok is really a game changer. There are nurses and physicians out there educating, guiding. I mean, there is Dr. Pimple Popper has like 5 million people who follow her.
We had a meeting yesterday with a small business insurance company, and we're talking TikTok.
See, I think that what we used to think, oh no, what's the credibility there? There's just a different path, and so again, disruptive. If I'm on and I'm, as they call them, doom scrolling, and I can find something about a wound, why not? So I think social media and TikTok is a big one, and then I jokingly said cookies, but people don't go to, yes, there is Dr. Google, but if I can intersect you as you're out there maybe shopping for some cute shoes, but I also had realized before that maybe you were looking up something about diabetic foot, well then maybe I can interrupt your scrolling and just have a little pop-up ad about, hey, think about this dressing.
Well, and that goes back to all of these, any type of engagement that's true engagement is about education, information. I mean, everybody's looking to be entertained. And if you can take something that's hard or that people might avoid and weave it into something more entertaining, you can really get more of your brand
absolutely
over the line with people.
Yeah.
All right. So as we prepare to close, are there any final thoughts? Are there any things that we didn't cover today that are on your hit list?
Yeah, I was actually going to ask you. So the big one for me is AI because it's a little scary, especially as marketers. But at the same time, I think we all should lean into it. So I'd love your thoughts as you work with so many different clients on what do you see as the future of AI 10 years from now?
Yeah. Of course, everybody's been talking about it 24 hours a day, and I've been in webinars, and I've got clients, and I think the best places that we're seeing clients really lean in and where we're leaning in are AI as it relates to KPIs and analytics, right? So, when you bring together these streams in digital marketing, but you have, you're talking about GPO, you have all these diverse data sources, right? This group, this distributor group has this part of the data, and we have this, and we have, So really, how do you bring more of that information together from an assessment? I do think we had some clients that were like, hey, maybe we'll write copy with it, And so there's a little bit of that, for short copy. But the place that I would say the final thing that I see as a best practice with our larger global clients is how do we set up a private instance of AI? Because you can't just feed all of your IP into ChatGPT. And so I think that's something that everybody initially played with it a little bit, but then all of a sudden you're like, wait a minute, what am I telling it? Right. So I think you have to be somewhat careful. I don't understand all of the inner workings of how you set up a private instance in the AI world, but there are several clients that are talking about that in partnership with a Google or, finding an on-premise. We're talking about premise. Find an on-premise solution or something that's behind a firewall, but you're leveraging some of these technologies and using it to crawl your data. So
I think that's a great idea.
It's all good.
I love it.
Yes. Well, I thank you very much for being an important client and
Thanks
a great
for having
friend.
me.
And this was wonderful.
It was.
So that is it for today's episode. I hope we have something equally as cool as schmarketing next time. Remember, there is a fine line between genius and insanity, and we're walking it. I'm your host, Moira Vetter, and we will talk to you next time on the Marketing Madhouse.
This morning in North Carolina, wheels are spinning. Determination is winning. A passion is now a thriving business, and it shows no signs of slowing down. How? The power of a conversation, like the one Clint Spiegel had with First Horizon Bank about starting a bike wheel manufacturing facility in Asheville. Now it's not just talk, it's rubber meets road. First Horizon Bank. Let's find a way. Go to firsthorizon.com/Clint. First Horizon Bank, member FDIC.